Welcome to the Colbert Report. I'm Mr. O'Grady here today with Mr. Sang. There are many different types of genetic disorders, but today we only have time to discuss one, which is sickle cell anemia. Sickle cell anemia is when red blood cells have a sickle shape. Anemia is when there are not enough healthy red blood cells, and it is most commonly found in Africans. Now, Mr. Sang will describe the symptoms of sickle cell anemia.
Symptoms of sickle cell anemia include fatigue, shortness of breath, rapid heart rate, paleness, jaundice, which is yellowing of eyes and skin, and abdominal pain in children. Symptoms that occur from blocked blood vessels due to abnormal cells include priapism, which is a painful and prolonged erection, poor eyesight or blindness, problems thinking or confusion from small strokes, and ulcers can occur on the lower legs in adolescents and adults. When the spleen fails to work, bone infections can occur, gallbladder infections, lung infections, and urinary tract infections. Other symptoms include delayed puberty and growth and painful joints caused by arthritis. Now back to Mr. O'Grady to describe the tests of sickle cell anemia.
Tests used to diagnose and monitor patients are: a blood oxygen test is tested by a doctor. Sickle cells interrupt healthy blood flow. Less amount of oxygen flows through the body due to the buildup of sickle cells in veins. A complete blood count measures the amount of red blood cells, white blood cells, and hemoglobin in the body. It also tests the amount of blood composed of red blood cells. A hemoglobin electrophoresis test measures the different types of oxygen-carrying proteins in blood. Hemoglobin is a protein in red blood cells that carries oxygen. Serum creatinine is a breakdown of product creatinine, which is an important part of the muscle. It can also be measured by a urine test. A serum potassium test measures the amount of potassium in blood flow. A sickle cell test looks for abnormal hemoglobin in the blood, which causes sickle cell anemia. Thank you for tuning into the Colbert Report. Now here's a word from our sponsors. At Safe Haven Hospital.
Son, are you alright? I took my son today to get tested for sickle cell anemia. You're gonna be alright, son. I promise.
Hello, Andrew. I'm Dr. Sang, and this is my assistant, Dr. O'Grady. We're here to give you a CBC.
Go.
Andrew, I must first sterilize your arm before the incision. Good job.
Now we must perform the incision.
Ah!
This is my blood vessel.
It turns out you do have sickle cell anemia, Andrew.
Oh no, oxygen's not going to my tissue. There is a single letter change in the 6th codon. One amino acid will change. Now valine is sitting in a place where glutamic acid is, which makes them stick together when oxygen is low. This distorts the shape of the red blood cell.
Their red blood cells become deformed, turning sickle-shaped. The bone marrow tries to make more red cells to make up for the loss, but can't keep up, causing anemia. Their new shape keeps them from moving properly through the body, and the misshapen cells can jam up and stick to the walls of the blood vessels. These clumps cut off oxygen to healthy tissue, delaying a child's normal growth and causing fatigue and extreme